back to our pediatric channel once again. So we have completed nearly around 7 questions there in our Inicet this recall 2024 recall. So starting off with the next question: the spastic quadriplegia in seen or associated with which of the condition? Your options are: first one is your PVL. PVL is nothing but your periventricular leukomalacia. B is basal ganglia calcification. Third one is cerebellum agenesis, and fourth one is cystic encephalomalacia. This question we have done in our TND session. So the spastic quadriplegia meaning the child's all the four limbs has been affected. The spastic quadriplegia mainly occurs in a term child. Okay, while spastic diplegia mainly occurs in your preterm children. So what is the pathology, or when you take an MRI, what is the pathology or MRI imaging behind this clinical features? So behind the clinical features, the spastic diplegia, behind the spastic diplegia, when you take an MRI of that child, you will be seeing a periventricular leukomalacia. Leukomalacia meaning a defect in the white matter. Okay, that is, there will be a loss of neurons, interneurons will be present. So the child will have periventricular leukomalacia. In child with your spastic quadriplegia, the child will have multicystic encephalopathy. So the answer to your above question will be your cystic encephalomyelitic changes. That is, when you take an MRI image of a child with a spastic quadriplegia, you will be finding a cyst. The all cavities will be found in your MRI imaging. Fine. Yes. Next, going on to your next question: what is the best indicator of some dehydration? So best indicator of some dehydration for this question is your thirst. It's a direct question. You can also get sunken eyes, skin pinch will goes back slowly only, but the best indicator of dehydration will be thirst. Fine. Yes. Going on to the next question. This is also a question given in your dehydration chapter, from dehydration chapter only. It is a multiple correct answer question. Fine. Which is not seen in some dehydration. So here they have given the options as: first one thirst, second one lethargy, third is sunken eyes, fourth is delayed skin pinch, and fifth is your decreased urine output. So in some dehydration, you can get thirst, sunken eyes, and delayed skin pinch. Only lethargy and decreased urine output, these two will occur mainly in your severe dehydration. So your lethargy and your decreased urine output, this both will occur in your severe dehydration. Fine. Going on to our next question. This is a very nice question. A child with the following Z score, that is, the weight for age is -3 standard deviation, height for age is -2.5 standard deviation, and weight for height is also -1.7 standard deviation. So they have given the Z score and they have asked you to interpret what is it. One is either severe acute malnutrition, or chronic malnutrition, or acute on chronic, and moderate malnutrition. Fine. Whenever a child has a Z score, that is a standard deviation between -1 to +1, it is considered as normal. Between -1 to -2, it is considered as mild. -2 to -3 is considered as moderate. Less than -3 is considered as severe. So here in question, everything is like weight for height is mild. That is, weight for height is -1.7 standard deviation. That means the child is having mild wasting. Height for age is -2.5 standard deviation. That is, the child is having a moderate stunting. Weight for age is -3 standard deviation. That is, the child is having a severe underweight is being present. That is, all the three parameters are being affected. So when all the three parameters are affected, according to your WHO classification, it is acute on chronic malnutrition. While in chronic malnutrition, only your weight for age and height for age will be affected. In acute, it is weight for age and weight for height. Fine. This is according to your WHO classification. This is given in your Elizabeth textbook of nutrition. Fine. Yes, this one I have also covered in your TND, and also in your previous year questions in your YouTube session. Also, I've covered this session. Fine. Yes. Next, ideal maintenance fluid in children. So, ideal maintenance fluid in this children will be always 5% dextrose with normal saline. There won't be anything called as half normal saline, and 1/4 of normal saline cannot be your ideal ideal maintenance fluid. While your 10% dextrose will come when the child is having any hypoglycemic situation. So the answer for this question will be 5% dextrose with plus normal saline. Next, indications for steroids in a child with IgA vasculitis. So indication for steroid in child with IgA vasculitis, that is in HSP. Henoch-Squalene purpura. I have already taken HSP in detail in our pediatric classes. But indications for steroid is they have given options as arthritis, GI bleed, severe rash, and pain abdomen. Normally, the mild HSP will resolve on its own. It is a self-limiting condition. The child, when he or she presents with a severe abdominal pain, you will give steroid. Or when the child has a GI bleed, you can start on with your steroids. So the answer for this question will be your GI bleed. If supposing if they have given it as a severe pain abdomen, that will be the answer. Pain abdomen will be present in a child with what is this HSP. Why? Because the child can have a bowel angina, or the child can because of your vasculitic features. Next question, which is not true about febrile seizure. Febrile seizure, it is present between 6 months to 6 years of age. Simple febrile seizures can be seen when the child is having less than 15 minutes of GTCS, and the child will have only one episode in one day. There is no need for anticonvulsants in treatment of your simple febrile seizure, but there is no recurrence. I mean, there is no recurrence of around 54 percentage in febrile seizure. So they have asked the question as not true about your febrile seizure. Not true about your febrile seizure is your 54 percentage recurrence will not occur in a child with a febrile seizure. Going on to our next question. Here the question is free flow oxygen in during your emergency situation in pediatrics. So the option given are self-inflating bag, face mask over mouth, face mask over mouth and nose, tubing over mouth and nose. So here the clinch to the question or to the answer here will be your emergency situations. So free flow oxygen during emergency situation will always be, you will give the face mask through your mouth and nose. The face mask should cover both your mouth and nose. Okay? So the answer will be a face mask over mouth and nose. It will not be just tubing, it will be face mask over mouth and nose. Yes. Next. So this finishes our all the 15 questions. The previous 7 questions I have uploaded it already, and these are the remaining questions of your Inicet 2024 recall in pediatrics. Thank you.